Well, welcome to DonorConnect, everyone. DonorConnect is a community conversation series. We're glad you're here. I am Sarah Ramsey. I am the Senior Director of Donor Engagement here at the Community Foundation of Greater Des Moines. And we're really glad that you took time out of your very busy schedules to join us today. Today's DonorConnect, it's been a part of a two-day series. We'll focus on the 2023 grant recipients from the Community Foundation's Better Together Fund. So again, this conversation series is designed to bring our community together to learn about and discuss our region's most pressing issues and our promising opportunities. We host these DonorConnect events throughout the year as a community conversation series, and we'll be sure to let you know about future events on the calendar. Sometimes they're in person, sometimes they're in Zoom. Regardless, we're really happy that you are part of the discussion today. And if you'd like to post a question in the chat, I will be monitoring the chat today, and we'll be sure to address that question and weave it into the conversation today. So now I'd like to introduce our moderator for today, Angie Detlefs-Trenton. She is our Chief Community Impact Officer who leads this fabulous work. And she's going to lead our discussion today. So take it away, Angie.
Great. Thank you, Sarah. Thank you so much. And good afternoon, everyone. I am really excited to spend some time with you all today, and especially with the colleagues that we're going to have a wonderful discussion with today about some projects that they have helped bring to life in our community. And we could not be more pleased to have come alongside them through our grant making program. You might have heard our mantra at the Community Foundation, or I certainly hope you have, and it is that we truly believe that we are better together. And our grant making programs are really funded through the Better Together Fund. So the projects you'll hear about today received grant dollars through this fund. And let me just give you a little bit of context on what the Better Together Fund is all about. The Better Together Fund is an opportunity for individuals, families, businesses, corporations, perhaps even through your estate plans, to give back to Greater Des Moines. Now, I often say to people, like, I don't have a crystal ball. I have yet to meet somebody who does. But the wonderful thing about the Better Together Fund is that we don't have to have a crystal ball to know what the future is going to bring, but we know that we're going to have some resources available to come alongside visionary leaders and organizations just like the two you're going to hear from today. So huge amount of appreciation to those who contributed to the Better Together Fund and to the organizations that help activate those dollars in our community. I'm grateful, and the Community Foundation is really pleased to partner on both sides of that work. So our grant making committee helps lead the investment process from the Better Together Fund. And I have the opportunity, along with our team, to work with some of our board members and also some of our community members on that grant making committee to help make those investments in projects. One of the things over the past few years that we've really focused on is connections to community plans. We are assessing and learning and listening to upwards of 20 regional vision plans to help identify where Better Together dollars might be able to be strategically invested, whether it's in areas like arts and education, workforce development, health, or supporting individuals and families. We always focus on activating those dollars based on what the community has said and the individuals have identified in our region as those promising opportunities and also those pressing challenges that we all face. So I'm really excited to have the opportunity to talk with some wonderful leaders, as I mentioned here today. And this series, as Sarah referenced, is about our 2023 leadership grant recipients from the Better Together Fund. Yesterday's session highlighted 3 of those organizations. So if you weren't able to join us, we invite you to listen to that online recording and hear more about those 3 entities. And today we have an opportunity to have conversation with the 2 other recipients of our leadership grants from 2023. In a moment here, I'm going to invite them to join us, and we're going to start our discussion today with really a mini segment about what these projects are that we were able to provide some funding support to. Today, joining me in a moment will be Kelly Huntsman, along with Nathan Simpson, who are both from primary healthcare. They're going to share a little bit more about the work specifically happening at their University Avenue location, and of course, provide some broader context on all of the things underneath primary healthcare's purview and their work in our community. And we're also going to hear a little bit more about the work happening at YSS and specifically the Ember Recovery Campus through conversation with Andrew Allen and Kara Warmy, who will share with us some of the work happening there and really an innovative model, not only in our community, but in our state. So excited for you to learn more. So first, let's invite to the screen here. Let's have a conversation with Kelly and Nathan and learn a little bit more about primary healthcare and the University Avenue project that the Community Foundation invested in. Kelly, Nathan, thank you so much for joining us here today. And just thank you so much for the work that you're doing. I still remember, Kelly, the first site visit that I went on as I became a staff member at the Community Foundation over 11 years ago was with you and your team. And, it was such a great opportunity to understand the scope of services of primary healthcare. I shouldn't have even used the word understand, be introduced to the scope of services with primary healthcare. So thank you for your leadership. But I would invite the two of you, tell us more about PHC and specifically what's happening at the University Avenue location. Would love to have some background.
Sure. Thanks, Angie. And just want to say thank you to the Community Foundation and all the donors who actually were there to support us in this project and over the years as well. So primary healthcare, a little bit about us. We're a federally qualified health center, have been in the community for a number of years since 1981. We provide low income, we provide access for healthcare services, other supportive wraparound services for low income and vulnerable populations in our communities. So when you talk about Better Together and the work that we do, our aim is really to meet the individuals and families and the communities that we serve and help address their needs. And so our particular project that we worked on, that the Community Foundation funded, was really to expand access to our medical and behavioral health care and improve health equity for a neighborhood in need. Our clinic is located at 1200 University. We are in the heart of the city. We serve a highly vulnerable population at that location, serving lots of homeless individuals. That is the site where our HIV program serves over 600 patients every year at that location. We have our centralized intake program. That is the program that helps individuals who are experiencing homelessness anywhere in the community in Polk County come into this site. So it's a very busy location. We have a full-time pharmacy. We have a dental clinic. I already mentioned our Ryan White Care treatment and prevention program, and then our medical and behavioral health care. And that is all of those services are in one location. And so the part of that program or at that site, what we expanded or will be expanding through this funding is our medical clinic. So currently now it is a very small clinic, about, I don't know what the square footage is, Nathan, actually, but it houses currently about 12 exam rooms. Every nook and cranny and niche of space is utilized. We usually provide about 1,150 patients visits per month. That capacity or that clinic could serve a lot more. We just physically do not have the capacity to serve. So the program, the funding that the Community Foundation and others in the community provided will allow us to add 10 additional exam rooms onto the 12 we currently have. Plus 5 flex rooms that we use a lot for intakes. We do a lot of HIV testing at that site. We do a lot of integrated health where the behavioral health and the medical person are meeting together. Those flex rooms would be great overflow rooms for that kind of work. We have our case management folks that are there. We have our homeless teams that could come in and help navigate folks that are experiencing homelessness. So all the big story is really expanding patient access for our patients, and those are patients and families that really need it. If Nathan has a moment, I think, to talk about the provider pods and the care coordination, I'll let him do that.
Yeah,
Absolutely.
I would love that, because you just described, Kelly. I mean, you went through, there's centralized intake for homelessness, there's dental clinic, there's pharmacy, there's behavioral health, there's all the things. And I did have a chance to come and peek through the door of the new locate or the expanded part of the facility, and also had a chance to walk through the halls of the current 12 rooms. And I can verify every nook and cranny was full and active. So I love this concept. So Nathan, yeah, I'd love for you to explain a little bit about what that pod structure looks like.
Absolutely. And again, thank you for having us today. So as Kelly and Angie have both described, we definitely utilize the space that we have. And at our university clinic, it is really our last medical clinic. So we have 7 medical clinics, both here in Polk County and in Story and Marshall counties. It is our last clinic where we have this model where we have a separate space for our provider staff and a separate space for our nursing staff. And so everywhere else, and soon to be at University Clinic, we have a pod set up. So essentially everybody that's on the patient care team, from the provider to the clinical support staff to the interpreters to the behavioral health consultant, all of those team members sit together in the same space, which really allows for that cross-pollination of ideas, that collaboration, just really better care coordination, which leads to better patient outcomes, and just a better patient experience and efficiency in the visits that we have for the patients that we serve. And so that is a desperately needed space. And additionally, I think, as we've talked about our HIV program, we provide both non-medical services for individuals experiencing HIV, as well as medical services for that same population. And so having them have a space within those patient care team pods is just hugely important to the care coordination for that population specifically. So this expansion allows us to do that, and we are really excited. Our staff are really excited about having that shared space to sit.
And before I invite the next group up, Nathan and Kelly, construction, how is it going? When will you be able to expand? I mean, going from 12 to 10 plus some flex rooms is no small feat, especially because you're still operational.
Yes.
Right? I mean,
Yes.
I'm like, I don't know the logistics, but you're still operational. So when do we think this great expansion for community will be open and ready?
So we are anticipating a completion date in August of this year. So they are, well underway. We've got half of the clinic, or half of the space. The total space is currently in progress. They're nearing completion. We anticipate that to be done in March. And then we will move everybody over. The whole clinic will shift over to that newly completed space. And then we'll do it all over again on the current space. So really looking forward to August and for that to be done. I know the crew has been great. The construction crew has been fantastic. Patients and staff have been really understanding. And so we're just really excited for it all to be done and have all that extra capacity to see patients.
That's great. Well, good luck with that. We're excited to see it when it's finished too. And thanks for that great overview. I'm going to invite Kara and Andrew now to join us from YSS, and we'll hear a little bit more about their project. And again, just really excited to have been able to provide some leadership grant funding to this work. And no, it's been quite the project in the making. Lots of partners have come alongside this. So Andrew Allen, Kara Warmy, thank you so much. Tell us more about the Ember Youth Recovery Campus.
Yeah, so excited to be with you, Angie and Sarah. I think we said this in our presentation, but support from the Community Foundation of Greater Des Moines is the Good Housekeeping Seal of Approval. So we're grateful to be a recipient of this funding and to share this project. YSS, while we're based in Ames, many people might know us as Iowa Homeless Youth Centers in Des Moines. We've been around for 47 and a half years, and I know that because we're planning for our 50th anniversary. We set a big, hairy, audacious goal 2.5 years ago, 5 years out from our 50th, to create 1 million intentional and substantive connections in the areas of health, self-sufficiency, education, and safety, trying to really impact social determinants of health. And as many of you know, you can't open the newspaper or have a conversation without talking about the needs that exist, not just for Iowans, but across the country, especially from a behavioral health standpoint. You heard the governor in her condition of the state address, and as the legislative session kicked up, really taking on behavioral health care as a focus. And we've been dealing with this right alongside primary health care for decades. And so the attention is important because the need is just that great. And our answer is Ember Recovery Campus. We started in crisis and emergency, and that's really where our founder found his niche. And you can't work in that space long before you realize these kids need treatment, mental health services, counseling, therapy, substance use, and you can't work in that space long before you start to ask, could you back the bus up a little bit and do things from a preventative standpoint? So that's where YSS is focused on prevention, providing emergency services and treatment to kids across the state. You're right, Angie. Ember Recovery Campus has been a vision in the making. I took over from a founder 8.5 years ago, which is hard to believe. After a great run at Principal Financial Group, getting to know many of the community organizations that have been partnering with YSS for a lot of years, and we have been running our programs out of old houses, which is great. I'm actually an alumnus of one of our programs, and I spent 4.5 months of life-saving treatment at 804 Kellogg in Ames, Iowa. But what we realized was it's just not the right tool for the job, and so we started to think about what would a space and facilities that are commensurate with our treatment look like. And we said, where would we set it? And there are, as we all know, healing power to nature and getting kids out of the cacophony and the busyness of a city and out into a rural setting. And so you can see the picture. Our slide's a little bit different, but we wanted to show just the beauty and the majesty and really the connectedness to nature that Ember Recovery Campus will bring. We broke ground almost 2 years. Was it 2 years ago? We broke ground 1.5 years ago, and we'll be done in September. And so this will bring 70 beds, needed beds of behavioral health treatment to kids and young adults across Iowa, focused on crisis stabilization, emergency shelter, and addiction treatment. And a new evolution for YSS, or the new program, is young adults. So there's no program in the state that's focused on 18 to 24-year-olds from a substance use disorder standpoint. And so we're excited about that. We're grateful for Kara Warmy and the role that she's playing to raise the level of awareness that exists for, not just YSS, but the need for substance use. This has been an undertaking of sorts from a financial standpoint. And so we're grateful for the Community Foundation and all of our supporters that have come alongside, and grateful to have Kara on the team helping us as well.
So you mentioned the specific 18 to 24, correct? That's sort of the target population. Kara or Andrew, can you talk a little bit about how young people will come to find the opportunity to be served within the walls or within the space, I guess, because it's a lot of it's outside the walls of the center?
Yes. Yeah, happy to. So the picture you're looking at here is our central lodge, and there'll be 3 cabins where the young people will stay. And the partnerships that you emphasize in the Community Foundation is the same model that we use. By the time young people, so they can be 18 to 24 is the group that we're adding for addiction treatment, but we will still have adolescents as well. So half of the addiction treatment will be 12 to 18-year-olds like we do now. And the emergency shelter also is for minors in partnership with the state and child welfare. And so we work from hundreds of different referral sources. So sometimes it is through the state and child welfare, where children are removed from abuse or neglect at home, maybe awaiting foster care placement, maybe awaiting going back into a safer home environment. So in that case, we're working directly with law enforcement and with the state. But in terms of the addiction treatment, we work with outpatient providers across the state, with families, schools, medical partners and emergency rooms, primary health care, right? Identifying where is substance abuse, that primary need that's there. And then we connect it with wraparound services, mental health supports, education. What are the next steps when youth are leaving as well? So that referral network and those partnerships across the community are what will really bring this to life, so that the right youth can come through our doors. We will serve youth from across the state, but already today with our houses in Ames, we help more kids from Polk County than any other county. And this campus now will be just less than 1.5 miles from the Polk County border. And we know that there will be so many partners we have across Greater Des Moines who say, oh, I heard about that center, and I feel like that would really help this youth heal and figure out their next steps.
One of the things too, I know we talked about and you shared with the grant making committee is the intentionality that YSS is placing on really serving youth in Iowa. I think that sometimes folks hear about the a complex and really robust offering like you all envision happening at Ember. To be something that's drawing out of town people all the time. And certainly that may be a component, but the intentionality that your board has around serving young people in Iowa who haven't had, Andrew, to your point, haven't had access to a resource like this in their own backyard. Just really appreciate that intentionality around that. And say again, how many young people you anticipate to be served out of this campus, whatever's easier, a year, I don't know your framework, but what might help us just understand the scope of impact?
It took us 40 years to serve 5,000 youth out of our substance use disorder treatment, and we'll be serving upwards of 500 per year. So we could do that. Yeah, we could do that in a decade. And it really just depends upon the acuity and the medical necessity as it relates to the duration of treatment. But you're right, Angie, there are 7,000 kids, according to SAMHSA, in Iowa that need treatment every year and don't get it. So Kara talked about the partnerships that we've got to build to ensure that people know that treatment is available, that recovery works. There are so many families that are struggling, that don't necessarily know the resources that exist, that don't know where to turn, that don't know how to navigate the system. And we want to make that really, really simple, because the sooner that you can provide treatment, we know the better the long-term outcomes. There's research and data that say from onset of a behavioral health need to treatment is on average 11 years, right? So can you imagine, right, how things exacerbate over that period of time? The sooner that we can get youth and young adults treatment, the better.
Great. Well, thanks for that. I made so many little notes about just connections. I would love to invite Kelly and Nathan to join us, and let's just have a conversation. Every time we have one of these discussions, it's like, oh, these threads like weave together. And one of the things you mentioned, Andrew, in your comments was, this used to happen in homes, or it still happens in homes. Sorry, but that's sort of been this model. And then I think about, Nathan, what you were describing and creating sort of this pod approach in this environment, and just how providing care has evolved. Just what is that like working in the field? And you're nonprofits. What has that been like, just evolving, how care has changed? I'm just curious your reflections on that.
Yeah, I guess from our perspective, yeah, it's changed a lot. I think at primary healthcare and other healthcare organizations in Iowa, maybe a little bit more so for us, just because we have so many services, so many wraparound services to help patients remove barriers. But I think we've moved a long ways from the traditional provider nurse model to this much more comprehensive care team within our own walls, plus the partnerships and the relationships that we make with others in the community. And so, we have clinics in Ames and Marshalltown, and we have made referrals back and forth to Andra and Carr, and we've made referrals back and forth to many folks. And in Polk County around homelessness, we work as part of the coordinating council. And so you can't do, I think the one thing in all the years that I've been working is you can't do this job alone. It is so overwhelming, the needs that people have, and the really truly legitimate critical life threatening needs that people have. There's too much to do alone. There's not enough resources to do it. And so, we've internally used that care team model to kind of help spread the work, and then making sure that you work with your community partners and never duplicating. That is one of the things as an FQHC, we're one of about 1,400 across the country, and we're funded by HRSA for some grant funding that allows us to provide sliding fee services to our patients. And one of the requirements that they always talk about is they want to see community collaborations, and they want no duplication. So if someone else is doing it, they don't want us to do it. They want us to fill a hole that isn't being filled. And so I think that's really important in today's healthcare world and social service need world, homeless need, whatever that is. It's critically important because there's not enough of us to do the work.
And federally qualified health center.
Yes.
And then I was trying to, so Andrew said SAMHSA. So I'm trying to catch the acronyms.
Well, substance abuse, mental health agency, or
Yep, perfect. Okay.
and
then
interestingly enough, Iowa, the FQHC is kind of the medical model. Iowa is implementing a CCBHC, which
Yes.
is the complementary behavioral health component. So yes, lots of acronyms. Don't ask me what that's.
That's
Yes.
all right. I'm recognizing, I'm calling it out there like it is, but definitely appreciate sort of that perspective. Anything YSS to sort of add to how you've seen care evolve?
Just a different take. I might say, so much of our healthcare is focused on behavioral health, and the stigma that has existed for years has been a topic of conversation amongst our communities. How do we get people to access services when they're afraid to tell someone they're struggling? Just like the pandemic pushed forward Zoom conferences and telehealth, it also pushed forward stigma and addressing conversations about mental health. I think it's much easier to talk about mental health needs today than it was even just a few years ago. What that has done is increased demand for services. And so FQHCs and CCBHCs are often serving the lowest income, the non-insured, underinsured populations that exist. And so as more and more people are pursuing services, especially in the mental health field, unfortunately, the people that have commercial insurance and the people that have can private pay oftentimes are the ones that are getting served. So I think it's important for your listeners just to remember that addressing stigma was great. We still have a ways to go on substance use disorder, but it's also increased the needs. So organizations like Primary Healthcare and YSS, we need people who really want to work with our populations, who really want to commit to agency type work as opposed to, private practice, which definitely fill a need. So we're grateful that people are accessing services. We just need more people to dedicate themselves to the field.
I would absolutely second that, Andrew. Workforce is a huge issue. I think when you talk about stigma too, I think one of the important the things that has been, I think, fundamental to the FQHC model is just because we have those integrated services, it does help to reduce that stigma, because people can be coming in for a medical appointment. Maybe they have a mental health condition, or maybe they have an undiagnosed or an unaddressed substance use issue. Our primary care providers can really identify that and then either refer internally to our own resources if we have the capacity, or refer to other partners. And so it's just easier to talk about some of those really hard conversations when you have a primary care provider that you trust, that you can share that with, and then we can refer out if we need to for better services. So stigma is a huge issue, and it's hard to get past that sometimes. So.
Well, one of you mentioned, I think both organizations certainly do this work, but one of you mentioned even too this idea about it's more than just accessing an appointment, but really looking upstream or in the rearview mirror to figure out what can we do at the very beginning or even pre-beginning of some sort of need being identified. And I mentioned as we started this conversation that the Community Foundation has been really looking at community plans to help think about how do we advance things. And in some cases, we've helped to use Better Together funding to spur additional research. So I think about the work that we did around the gaps in behavioral health services analysis years ago that really helped us identify, yeah, there are gaps, and where are those? The Community Health Needs Assessment report, all of that. But what the Community Foundation is looking at when it comes to a health investment it was really around advancing physical and mental health resources through systemic efforts. So thinking cross, longitudinal, cross partnerships to support populations that have inequitable barriers. And when I think about both of your organizations, I think that is one of the things that the Community Foundation and the Grant Committee really saw you executing so well and leaning into, right? Like, that's hard work. That's a big mouthful to say, you're advancing access to both physical and mental health wellness through this whole idea of a system, and for people who have inequitable barriers to get there. So you've got a group of people listening in today, and certainly funding, right? Funding is so important. What else do you hope that folks who want to advocate for this type of work or support this type of work, what else could we do?
Andrew, I'll let you take that.
Well, I've been talking the longest.
I know this is a very easy question. But if what are things that you hope supporters out there are helping you do? I mean, I think reducing, talking about care, behavioral health services, talking about substance abuse treatment to really address some of the stigma things that we were talking about. That's real.
Yeah.
Are there other
I'll
things
jump
that come
in.
to mind?
I think one piece that, when we're launching into these different projects and you're building something capital, that gets people really excited, right? They're going to build a building. It's going to be new and fancy. We're going to do something in a new way. And I love, Angie, that you noticed that in both cases of these projects, we're taking services that were somewhat disparate and you're bringing them together and encouraging more collaborative, more continuum of care for the services that people need. We get that building built, right? But there are those ongoing needs where we are serving the most vulnerable populations. And so as people are listening, I think we're watching trends in philanthropy that, more dollars are coming from smaller numbers of people giving bigger amounts. That's an aging demographic who is seeing themselves giving financially. And so we're thinking a lot about estate planning and endowment funds and that long-term sustainability. And so, in the case of our Ember campus, we've been blessed to raise the dollars that we need to build those beautiful buildings that you saw on the screen. But we're knowing that there will be those ongoing maintenance needs for that. There will be the other pieces we want to add in workforce development, exposure to trades for 18 to 24-year-olds who are there. Other things that we know will help the long-term success of these clients. And so financial investments now for us, we are looking for those partners who believe in investing in, our Ember campus endowment, do that through the foundation, do that directly with us, but understanding it's not just getting the bricks in the ground and building the buildings, but it's how do we set it up for the legacy impact and the long-term success of something that is operating as a nonprofit model, right? And it is difficult then to identify those things that would help you take it to the next level, but it's not what insurance covers, right? It's not what Medicaid covers. It's the things that we know will help the youth be the most successful.
I'm looking over here at Nathan on our screen, and Nathan, I believe you're Chief Operating Officer, right? Is that the title there? I'm sure,
That's correct.
The numbers, the bill doesn't get paid exactly at that amount. And it is a nonprofit, challenge, a workforce challenge, all those things. Any other reflections on what Kara said? I'm sure it's real in your life.
Yeah, I would, I guess, second what Kara said. I think, once the capital projects are finished, which it seems like they're never finished. We always have some type of capital project going on.
I told you, Kara, we'll just keep going.
No.
It's the ongoing operations that cost, and those costs will never cease to exist. In fact, they'll just continue to build. And so, as Kara and others have mentioned, and as you mentioned, Angie, we often have far more expense than we have revenue coming in, especially for our organizations because of the populations that we serve. And so that is the trend that we see in our communities, is that we continue to serve more and more and more uninsured or underinsured patients. And that's challenging, especially as our traditional funding sources don't continue to increase the amount of money that they allocate to our programs. And so, ongoing support from individuals in the community is super important. We look for partners to walk alongside us and help us do this work, not just the fun capital projects, but also the, maybe the less glamorous operational costs as well. And Kelly, I don't know if you would have anything else to add.
I would just add a couple of quick things. So this particular project, we still do have some capital needs left. So if there are partners that you know or friends that you have that really feel like healthcare is the avenue to go, we certainly would love to be connected. And then I think there are just also some just real little things too, like this particular location, we serve a lot of homeless patients. And so we're always doing little campaigns around, we need winter coats, we need socks, we need this and that. And those are just little things. And so sometimes, that's also super, super helpful. And then just echo everything everybody else said around, the uninsured continues to grow. The needs are always there. The funding is never as much as the need is. And we just try to do our best. So, where this is something that's close to your heart, then we certainly would love to partner up with that. So, and as I'm sure Yes would as well. So.
Yeah, I think, Andrew, I know you talk a lot about how folks can come alongside, with YSS and, whether it's donation of items to the Iowa Homeless Youth Center location here in Des Moines or, other things across your organization too. There are the whole spectrum of ways to engage, which is really helpful. Just to kind of piggyback on what Kelly was mentioning, for those on the call, for those of you who have your donor advised funds at the Community Foundation, of course, if you want to come alongside the Community Foundation in supporting grants from the Better Together Fund through leadership grant support, these are two projects that the foundation did invest in last year, as you know, and donor advised funds is an easy way to make that connection. Also, the grant recipients from last year are all on Give DSM. So even if you don't have a donor advised fund and you know someone in community, maybe yourself, maybe it's, I have my kids check out Give DSM and see what's happening in the community. You're never too young to start understanding that work. Check out Give DSM, think about making a contribution. And if it's not these capital projects, but if you are tied to the mission and what they do, like Kelly suggested, learn more about what's happening, because there's so many layers to what you all do. I have had the real privilege of learning about your organizations over the years, but every time I meet with one of you, it's like, oh, I didn't really realize the complexities of all of those things. And I think that's both the blessing and the curse, right? When there's so much happening, so many more complexities in those that you're serving, and so many more challenges. But I will say, lots of innovation. Mm-hmm. Right? So YSS, this is the first of its kind in Iowa. It's not like there's 100 of these in every other state, correct? I mean, this is a relatively emerging model, right?
Yeah, nature-based, trauma-informed, experiential is kind of the underlying themes for the campus. And, again, we did have good public support and private support. We can always use more support. I heard somebody recently in leadership say we want 2 or 3 more of these. So with the opioid epidemic, with the reduced perception of risk as it relates to smoking marijuana, the access from a recreational standpoint, I don't think anybody thinks this issue is getting better. And so, man, it stinks to have to build new facilities and spend a lot of money in order to provide treatment for something that could have been potentially prevented. But the investment is important, and just the continued focus on understanding that treatment works and that recovery is possible. We've talked about, wanting to make Iowa the very best place in the country for people to recover. And I think that, we've got that wholesome nature about us, and we like to be innovative. It's one of our core values at YSS. Sometimes my team likes me to be not quite so innovative because, there's just so much need, and primary healthcare sees it. We're always trying to do more. And it's, I do want to say that innovation is important, but the Community Foundation has understood and convened conversations about general operating support as well. Oftentimes we get grants that don't just not create a margin, we've got to bring a match, right? So, you know, that's 90% of the total cost or even 50% of the total cost for a project. And we've got to go out and find additional funds. And so I see it now on this side of it for 8.5 years, just how stretched nonprofit organizations are. You can't always be as nimble as a for-profit, because to be an FQHC, to be a CCBHC, you've got a lot of administrative burden to, you know, ensure that you've got the reports and, you know, the everything, all the I's dotted and T's crossed. And so just continued conversations about, you know, supporting general operating support in Marshalltown. In this building just a month or so ago, we heard about the community foundation here, enabled by the Greater Des Moines Community Foundation. Instead of having an application process, they just have a conversation. They literally bring an organization in and just talk, and then they give them a check. So again, we're not asking for, you know, not having accountability, because that's important to organizations like YSS and primary health care, but just remembering how important it is to support the infrastructure of this work.
Well, and get to know the people too, and ask the questions about the programs and the impact. And one of the things I always really enjoy is, you know, what is a barrier that you're facing right now? And also, you know, what is most optimistic to you as organizational leaders? And those are great questions for donors to ask nonprofit organizations as well. Well, you know, I really appreciate all four of you here on the screen today. I have gotten a lot of good insight from you over the years, and I really do appreciate sort of the way in which you approach your work and the way in which you approach partnerships. And it truly is an honor for the Community Foundation to support both of these projects. And, you know, just grateful for what you're doing to advance that goal of access to physical and mental health and wellness, especially for those who are facing inequitable barriers. And I think these are two great examples of that. And you work with lots of partners to get that done. You know, we often say philanthropy is just one part of the equation, right? It's the money, but you still have to have the people on the ground doing the work in order to make the things happen. And I just want to remind everybody, donors and others, that it is part of an equation. And without the folks on the screen, we don't have the good work happen in the community. So thank you so much for that. I mentioned earlier, if you're interested in supporting these two projects that were supported through the Better Together Fund, please check out GiveDSM. Please connect with these colleagues. There's lots of wonderful stories, and they could go on and on. And we all look forward to seeing the final renderings. We're going to be close in timeline here, September and August. It's going to be a great expansion of services in the Central Iowa region. So thanks to all of you for your leadership and for your time here today. Really excited for what you're doing and grateful for that. So with that, I guess we'll end with the mantra of the Community Foundation, which is, you know, simply better together. And these are wonderful examples of that in action. So with that, we'll see you all next time at our next Donor Connect. And thanks again for being a part of the conversation today.